this is a review from class of Chapter 4 out of the Lewis book. First, we're going to talk about the Transtheoretical model, and this comes from a background of psychotherapy and behavior changes. Positive reinforcement of a learner's achievements is critical in making lifestyle changes, and reinforcement of those changes being made is an important nursing intervention. Pre-contemplation is a stage in which there is no intention to change behavior in the unforeseeable future. Many individuals in this stage are unaware or underaware of their problems. Contemplation is a stage where people are aware that a problem exists and are seriously thinking about overcoming it, but have not yet made a commitment to take the action. Preparation, this is a stage that combines intention and behavioral criteria, and people that are in this stage are intending to take action like in the next month, but have been unsuccessfully taken action in the past year. Action. This is the stage in which an individual modifies their behavior, experiences, or environment in order to overcome the problem, and the action involves the most overt behavioral changes and requires considerable commitment of time and energy. Maintenance. This is the stage in which people work to prevent a relapse and consolidate the gains attained during the action. And then termination would be it takes on a new self-image and the old behavior is no longer a threat. So an example would be, say a patient needed to make diet changes with diabetes, and they failed to do so because they state they're choosing not to follow the diet. Although the patient behavior hasn't changed, the patient's ability to explain the information indicates that learning has occurred and that the patient is choosing at this time to continue with the previous diet. The patient may be in the contemplation or preparation state in the Transtheoretical model. Contemplation of a change would be indicated by a statement like, "I know I should diet and exercise," and then the nurse would reinforce the need for change and continue to provide information and assistance with planning for change. If they accomplish changes then, the patient could be in the action stage of the Transtheoretical model when reinforcement of the changes being made is an important nursing intervention. Teacher learning process. Motivation and readiness to learn depend on what the patient values and perceives as important. Adults learn best when given information that can be used immediately. Since adults learn best when given information that they view as being needed immediately, asking a caregiver and patient to prioritize learning needs is likely to be the most successful approach to home management of health problems. Reading level for patient teaching material should be at about a 5th grade level. Do not use too many medical terms. If a patient is illiterate, then avoid the use of written material. The lack of a reading ability does not necessarily imply that the family should be included in a teaching process. Talk to the patient. Motivation and readiness to learn depend on what the patient values and perceives as important, and learning goals should be clear, measurable outcomes of the learning process. Process of patient teaching. Assessment is the first step in assisting a patient with health changes. Adult learners are independent, and a nurse should act as facilitator for learning rather than as the expert. And they learn best when the topic is of immediate usefulness, and long-term goals may not be very motivating. Principles of adult education indicate when readiness and motivation to learn are high when facing a new task like diabetic injections or wound care, and when demonstration and practice of skills are available. When time is limited, the nurse can focus on priorities of teaching, such as how to test blood glucose, administer medications to control the glucose levels. An adult education is most effective when focused on information that the patient thinks is needed right now. A long-term response may need to be assessed after discharge, and this is where the home health referral would allow this to occur. Role-playing can allow the patient to practice assertive behavior and then receive feedback about how the behavior is perceived. The role of patient and caregiver teaching. You're responsible for patient and caregiver teaching, and teaching occurs whenever you work through informal or formal opportunities. A teaching plan includes assessment of a patient's ability, their need, and readiness to learn, identification of problems that can be resolved with teaching. Teaching involves establishment of goals, teaching information, evaluating the effectiveness. And patients have a right to receive written information about their care that they can reasonably be expected to understand. Learning is a persistent change in a person as a result of an experience where they acquire knowledge or skill. This brings teaching as an interactive and dynamic process and involves a change in a patient's knowledge, their behavior, or attitude in order to maintain or improve their health. Although learning may occur without teaching, teaching helps to organize information and skills to make learning more efficient. Learning may result in observable change or the potential to change, and patients retain the right to use or not to use the acquired information or skills. Teaching is not just imparting information. It can be planned. It can be spontaneous. Uses a combination of methods like instruction, counseling, behavior modification. It definitely involves the patient, the caregivers, and you as the nurse. Process of patient teaching. The assessment of learning needs to come first, and that's to determine what the patient already knows, if they have misinformation, and any history of past experiences with health problems. Assessment should also include caregivers to determine their role and ability to care for the patients at home. Each person has a distinct style of learning, like visual, reading or pictures, auditory, by listening, physical, by actually doing it, kinesthetic. Ask how the patient prefers to learn and how they've learned in the past. And auditory visual methods like CDs and DVDs should be used whenever possible and when patients specify them as a preferred method. The readiness to learn and motivation depend on multiple factors such as perceived need, attitudes, and beliefs. Identify what information is valued by the patient. Readiness to learn is increased if the patient perceives a need for information, has a belief that a behavior change has value, and perceives the learning activity as new and stimulating. Before teaching, determine where the patient is in the stages of change. If they're in the pre-contemplation stage, just provide support and increase patient awareness of the problem. Nurses in outpatient settings and home health can continue to evaluate their readiness to learn. Positive reinforcement is a strong motivational factor and needs to be incorporated throughout the change process. Other members of the healthcare team can do positive reinforcement. An example is that a nursing assistant cannot teach how to do an incentive spirometer, but they can remind a patient to do their spirometer that was given to them or give them a pamphlet on spirometers after the teaching was done by the nurse. Learning goals should be clear, attainable, and measurable, relate to the intended outcome of the learning process, guide the selection of teaching strategies, help evaluate the patient's progress, and are parallel to patient outcomes in the nursing care plan. Standardized nursing care plans may be available and should be individualized and modified based on a patient's unique sociocultural and learner characteristics. As the nurse, the patient, and the patient's caregiver must mutually prioritize their learning goals and develop a plan for the teaching learning experience. Teaching strategies can include any combination, like discussion, which is the most common, lecture discussion, demonstration, return demonstration, role play, CDs, DVDs, computer-based programming, and peer teaching, which you find that in support groups. Learning materials should be used in multiple formats and located from all available resources within a facility, from support agencies, professional groups, government agencies, universities, pharmacies, volunteer organizations, the library, and of course the internet. Telehealth, interactive video, wireless technology, and podcasting are technologies that can help patients manage their health. An evaluation is the final step in the learning process, and this is to measure the degree to which the patient has achieved the learning goals. Evaluation strategies for teaching include observation of the patient directly, show back, show me what you learned, observations of verbal and nonverbal cues, discussion with the patient or caregiver that they're able to teach it back, and a patient self-evaluation of progress. Assumptions regarding patients' knowledge and skills can be dangerous. Evaluate all past and new learning as well as present abilities. Follow-up after discharge does enable a long-term evaluation of their learning goals, and this is where home health becomes collaborative. Written appointments and referrals should be given to patients and their caregivers, and documentation should include complete, clear information and be available to all members of the healthcare team. The nurse provides post-operative instructions for an adult patient after cataract surgery. Which statement, if provided by the nurse, would be most appropriate? The correct answer is C. To prevent infection in the eye, wash your hands before changing the eye patch or using eye drops. Option C has no medical language. Medical language is included in A, B, and D, and medical language can be intimidating and frightening to patients and should be avoided. When using the Transtheoretical model of health behavior change during patient teaching, the nurse identifies that the patient who states, "I walked regularly for about a year to help prevent osteoporosis, but recently I haven't been motivated to continue." The correct answer is A, action. In the Transtheoretical model of behavior change, action is defined as the patient begins to change behavior through practice. However, the patient may experience relapses.